So welcome to today's full committee hearing, an examination of bureaucratic barriers to care for our veterans. As we all know very well now, during a committee oversight hearing in early April, we came forward with the results of a committee investigation that had uncovered evidence suggesting that dozens of veterans died while waiting for care at the Phoenix Department of Veterans Health Care System. Just over 2 months later, we know now that in addition to 23 veteran deaths at the department linked to delays in care earlier this spring, at least 35 more veterans died while awaiting care in the Phoenix area alone. What's more, a VA audit released earlier this week found that over 57,000 veterans have been waiting 90 days or more for their first VA medical appointment, and 64,000 veterans who have enrolled in the health care system over the last decade never received the appointment that they requested. That's 121,000 veterans who have been waiting for care to be provided that they earned. That number exceeds the population of several mid-sized U.S. cities like Athens, Georgia, Abilene, Texas, or Santa Clara, Texas, or even Evansville, Indiana. And I fear there's more yet to come. Yesterday, I spoke to a group of VA providers from across the country at an event for the National Association of VA Physicians and Dentists. Speaking about the current crisis engulfing the department, they've said that VA's procedures and processes are inconsistently applied, and often prevent efficient use of personnel. This statement echoes the serious calls for alarm that we've heard from others over recent weeks. During a recent committee hearing, Dr. Day, VA's Assistant Inspector General for VA's Health Care Inspection, testified that VA suffers from, and I quote, a lack of focus on health care delivery as priority one, unquote. As a result, quote, several organizational issues that impede the efficient and effective operation of the VA health care system and place patients at risk of unexpected outcomes, end quote. In an article published last week in the New England Journal of Medicine, a former VA Undersecretary for Health, Dr. Ken Kaiser, and a current staff physician at a major VA medical center wrote that the systemic data manipulation and lack of integrity VA experiences are but, quote, symptoms of a deeper pathology because simply VA has lost sight of its primary mission of providing timely access to consistently high-quality care, end quote. All of these remarks go to prove what we have already known. The VA healthcare system and the bureaucratic behemoth that accompanies it is complex, and its problems are even more complex. I believe that the majority of VA's workforce, in particular the doctors and nurses who provide our veterans with the care they need, do in fact endeavor to provide high-quality health care. Unfortunately, VA leadership has failed those employees almost as much as it has failed our veterans. And correcting those failures is going to take a lot more than the Band-Aid fixes the Department has proposed thus far. It's going to take wholesale, systematic reform of the entire Department, starting with holding senior staff accountable. VA hasn't gotten where it is today due to just bloated and ineffective middle management, or lack of training and professional development for administrative staff, or inefficient or non-existent productivity and staffing standards, or cumbersome and outdated IT infrastructure. The Department got where it is today due to a perfect storm of settling for the status quo. VA cannot continue business as usual. It's very clear the status quo is not acceptable, and it's time for real change. Again, beginning with accountability up to the highest levels of VA bureaucracy, and I hear repeatedly from the VA about its delivery of high-quality, patient-centered care. But this committee, Republicans and Democrats alike, will not rest until we hear that same assessment from every single veteran seeking care. It's time for VA to tell us the bad news, not just the good news.